PRP, or platelet-rich plasma therapy, has been around for years, but specifically for hair has been around now for probably 4 or 5 years, but it's definitely, the techniques have changed and it's growing rapidly in popularity. Now the theory behind it is that what we do is take the patient's own blood and spin it and take out the platelet-rich plasma where the growth factors are, and we inject those growth factors back into the scalp. Now, with those growth factors around the follicles, they help stimulate bringing hairs back from a resting phase or from being terminal hairs to actually active growth and active hairs. PRP, or platelet-rich plasma therapy, is good for males or females with thinning hair. If you're completely bald, it really doesn't work. So what you need some hair to thicken up. We found that since a lot of females don't have a great donor site and they're not great candidates for hair transplants, the female population is probably the group of patients that have benefited most from this procedure. The actual procedure, the first thing that we do is draw off about 22 cc's of blood. We spin it in a centrifuge. After spinning it, we were able to get about 7 or 8 cc's of platelet-rich plasma. These 7 or 8 cc's are drawn off the centrifuged blood and then injected into the scalp. The only painful part of this, or slightly painful part of the procedure, is the actual injection into the scalp. And I can't, for me to say it's painless would be a lie. We have some techniques that we use that can help to alleviate the discomfort. But we haven't had any patient that's not been able to go through it because of the discomfort, but it does hurt a little bit to have it done. PRP has been performed for around 5 to 6 years now for hair loss, and there have been quite a few studies done over the past, especially over the past 2 or 3 years, that have done hair density tests on patients before and after the procedure. And virtually all the studies have shown about a 60 to 70% response rate. And the response rate includes both an increase in density of the hair and also shaft diameter of the hair. We do it once a month for 4 months, and then every 6 months after that. The patients usually start to see results after the 3rd or 4th treatment. Virtually every hair loss treatment, except for platelet-rich plasma therapy, has side effects. The nicest thing when patients come in here and they're looking for a treatment for their hair loss with no side effects, we suggest PRP, and it's easy to do. You're using your own blood. There's no chance of any side effects whatsoever. The patient can drive to the office, drive home after, and it's an easy procedure.